Like I always say, education intensifies knowledge, knowledge builds confidence, and confidence maximizes potentials. And just like the saying goes, health is wealth. It is on that note, I have a distinguished personality in the studio. It's not other person but a consultant, metabolic medicine, physician, Department of Chemical Pathology, University of Calabar Teaching Hospital. Is here to tell us more on the causes, the treatment, the symptoms, and warning signs of diabetes. It's no other person but Dr. Kenneth Inaku. Hello, sir.
Good morning, viewers.
It's nice to have you here.
My pleasure.
Yeah, talking about diabetes, what should people know?
Yeah, thank you very much. Diabetes is a metabolic condition. What that means is that an organ that is supposed to function to regulate glucose metabolism is deranged. The pancreas is the major organ that produces insulin, so that when you take food, insulin is the hormone that drives in glucose into the cells for energy creation and utilization. But that is defective in some persons, and because of that, you will find that because the body does not utilize glucose, you find that the blood is concentration of glucose is very high. That is diabetes.
You know, a lot of persons have the belief that sugar is actually the cause of diabetes. And like we always say, we tell the public the story they need to know. We keep them informed on happenings around the world. What is the main cause of diabetes?
Yeah. Thank you. There are about 4 types of diabetes. Now, the first one is type 1 diabetes. And type 1 diabetes just has to do with the fact that that individual has destroyed its own cells that produce insulin.
How?
So that means that it is an autoimmune condition. So the body develops antibodies that destroys the beta cells of the pancreas. So that means that that person does not produce insulin. And when he takes in food, which most foods are carbohydrates and they contain glucose, so since the body is not utilizing the glucose, the glucose will be high in the blood. That is type 1. Now, for type 2 diabetes, in type 2 diabetes, it comes when the person is getting older, like after 40 years or 50 years.
It's natural?
Yes, not natural. There is some underlying problem. The underlying problem is mostly genetic. So if, for example, your parents or one's parents are diabetic, the chances of children developing, or when they get to adulthood, developing diabetes is very high, and that would likely be type 2. Type 1 has no genetic basis. It just has an immunological basis. But type 2 has genetic basis. So you take that defect from your parents. And then, as you are growing up, the body starts developing resistance to the use of insulin. The receptors don't recognize insulin. There is also a little defect in the production of insulin, but the major defect there is how the receptors will recognize the insulin. So they could have insulin as against the type 1 that don't have insulin at all. You know. Now the type 3, or what I will call gestational diabetes mellitus, when a woman is pregnant, the body hormones mobilizes glucose and fat for the baby so that the baby will grow. Now, some women come down with a defect in the management of the mobilization of glucose and by other hormones. Now, what that happens is that they develop what is called gestational diabetes. So they were not diabetic.
Okay, but from the course of our job, we were meant to interview some persons, and while in the course of the interview, the person made a research that sugar does not cause diabetes, but the consumption of so much sugar, you tend to become obese, and when you're obese, you're prone to having diabetes.
Good.
How true is this?
Good. That will apply for type 2. You know, there is a saying that genetics loads the gun and environment pulls the trigger. Now, if I am coming from parents who have defects in the regulation of glucose, I better watch my lifestyle. If I go ahead taking too much sugar, I am overburdening a system that has a defect already. So you see that, yes, if I control my lifestyle, even when my parents are diabetic, I give to the body doses of glucose and those things that
So why do
that
diabetic patients consume sugar? Because I've seen situations whereby when they are weak, they tend to give them sugary liquid like Coke and all of that.
Now, the body has a primary fuel, and that is glucose.
Okay.
In fact, the brain cells almost use no other fuel than glucose. Fuel, we have carbohydrate, we have fat, and we have proteins. But the body uses first carbohydrate, and that is glucose. So you cannot tell a diabetic not to take carbohydrate again. Now, in the situation that you are talking, that is cases whereby there is complications, like hypoglycemia. Hypoglycemia, that is low blood sugar.
I wanted you to break it down.
Low blood sugar.
For the interest of our viewers.
Yes. Now, low blood sugar does not just occur in diabetics. No, it never does. It is a complication of treatment. So when you find a patient who is taking anti-diabetic drugs, some persons take insulin, that have to replace insulin. The insulin could dry off the glucose, and they would need immediate replacement of glucose. And so we tell them, go about with sugar, go about with a bottle of Coke or something. Okay,
so what are the warning signs of diabetes?
Good. So the signs of diabetes, in fact, for type 2, by the time we meet the patient, diabetes has been there for about 10 years without any sign. In fact, I had a health outreach 2 weeks ago, and I saw a woman with glucose of 17 point something millimoles per liter, and she was fine. She didn't have symptoms already. Now, but generally, persons with diabetes would start complaining of peeing too much.
Okay.
That is one. And drinking too much water, so they will get easily tested because they are releasing water, they will have to drink more. They also complain of weight loss, because since the body is no more utilizing glucose as it is, no matter how much they eat, it just stays there in the blood as glucose without entering the cells for them to gain weight. So they start losing weight.
But there are other symptoms of health issues that come down with same symptoms. How do you differentiate here?
Well, you see, there is what you call secondary diabetes. So there are some health issues that one may have that may also present with diabetes. But in the differentiation of diabetes from this health issue, it is both clinical diagnosis and laboratory diagnosis. So the person comes to the lab, we will take the blood, we do the blood glucose or the blood sugar as the layman will call it.
Okay, shortly before we let you go, what is the normal range for blood sugar?
For persons who are not diabetic, 3.5 to 5.6 would be normal. But there is another situation they call pre-diabetes. So the blood glucose will move from 5.7 to 7. Now, that one is called pre-diabetes. We have fasting plasma glucose, we have also non-fasting plasma glucose. So for fasting plasma glucose, above 5.6, you are diabetic.
Okay, so what food should a diabetic avoid, and which would they consume?
There is no selection of food for diabetes, actually. So we tell diabetics to eat all foods, but the major thing to control their blood glucose is portions.
That's the preventive measures here.
Yes, no, not preventive. Even that, it is both preventive and in management. Yes, diet. You have to reduce the portions. In fact, we tell them to use their feast as a mark of what they are about, or
they can consume everything.
They can eat everything, but whatever disturbs them, even that as a normal person, whatever you are not
allergic
with, you just allow, but we don't restrict them.
Okay, so a viewer just said some questions, but I think we need to ask just one. Is diabetes treatable here?
It is treatable. It is not curable.
How do you mean?
So we treat, we manage the condition. So you must see your doctor perhaps monthly, 2 weeks, or 2 months, depending on the complications that you have developed. So we can tell you, come back. But the complication is, or the problem is that some persons, when this diagnosis is made, they leave the hospital, not taking the drug the doctor has prescribed, and for the next 5-6 months, 1 year, they have not come back to the hospital.
Yeah, because I know some persons will tell you they don't go down with the English medicine. They do more of local medicine here in curing diabetes. How true is that?
Well, I've heard stories that Zobo can bring down blood sugar and some of these things. But I'm a doctor, and I use orthodox drugs, which I know work and which I know their mechanism of action. So I wouldn't, those who have gone to do traditional medicine, eventually some of them develop complications, and they come down and spend even more than what they would have used.
One cause of diabetes?
Genetics, environment, lifestyle. Yes. So
Preventive measures
one can
again.
eat his life into diabetes.
So let's look at some preventive measures.
So preventive measures, number one would be lifestyle modification. So I do advise my patients, okay, avoid obesity, avoid too much drinking, avoid smoking, eat right, take your breakfast. It's one of the most important meals of the day.
Okay, I think I must ask this question before I let you go. Does high cause of high cause of sugar intake causes diabetes?
It could predispose, and for a genetically predisposed person, it will develop diabetes.
So one should
So,
avoid
but when
sugar.
you are not genetically predisposed, I am sure you can drink all the Coke and all the sugar. The body can handle it because there is no defect. In fact, there is an illustration I use for my students. If you take a car here and go to the Canada Junction and come back, it may take you. But if that car has a problem and you want to get to you, by the time you hit 100, 120, you can see the car park up because there was a problem.
Dr. Kenneth Inaku, finally, before we let you go on set, that high cholesterol causes diabetes.
Now it is in the reverse.
If I don't ask this question, I think my viewer is busy disturbing me with that same question repeatedly. So I think
it is in the reverse.
High cholesterol.
Hypercholesterolemia is a complication from diabetes because as soon as the body cannot use glucose again, it sources for other fuel, and the first is lipids. So it starts breaking down more lipids than you need, and that is where cholesterol comes up.
So how do you prevent this?
By controlling the diabetes. So you take your drugs, you come to the hospital, we will do lipids, and then when it is high, we will give you drugs to bring down the lipids.
And the cholesterol, they have the good cholesterol and the bad cholesterol.
Well, that is for the layman. Cholesterol is cholesterol. Yes.
Your final word before we wrap it up for today.
So health check will be the main advice. Go to your doctor, even when you're not sick. Just go and get a health check. Something may just be discovered, and it's time to save time.
I've been speaking with Dr. Kenneth Inaku, a consultant, metabolic medicine physician, Department of Chemical Pathology, University of Calabar Teaching Hospital. And like he said, health check is very important. And like I always say, health is wealth. I think we have to leave it here for today. Thank you so much for coming once again.
Thank you. It's my pleasure.